I have asthma,
Okay.
so I guess I have an interest because from a personal perspective, that is what brought me in to see an ND, a naturopathic doctor, in the first place. It got really out of control for me when I was in university, and I think someone else referred me. They were like, you should probably go and see an ND because the treatment was always just the same, right?
And
And
what
they were
was it?
like, well, you just have to take your medication more regularly.
What was it doing to you?
I just felt more physically like I couldn't exercise physically as I normally could. I couldn't, temperature wise, I was just really sensitive to things in the environment. And then I'd have an attack, which is like obviously not fun and kind of scary. Just had them more and more. And I went to see an ND and learned that there were some major nutritional imbalances that were driving it, food sensitivities. And for me, it was largely stress related. And, once again, when it comes to stress, everybody has stress in their lives. But if you don't, sometimes you need someone to help you recognize really how are you feeling it, right? How is it showing up in your body? How can you acknowledge it better and do things that just help keep it in check, help stop the physical manifestation from happening before you actually get there. So that was huge, and that was like an epiphany for me, right? That was how I was sort of trying to manage stress, or not very successfully, right? And so once again, like asthma is fairly common, but there's no one size fits all approach. Once again, yes, you can use herbs. Yes, you can use acupuncture. You can use certain nutrients and supplements, but you have to understand why is it happening for that person, right? What's driving it on the deeper layers, and then correct it from there.
When you're working with patients who have asthma, do you find you can get them quite substantial relief from it?
Yeah, I mean, a good marker that you use a lot, and once again, I see this a lot in kids, is actual use of puffers or inhalers, which is really common conventional medicine.
Yeah.
So it's nice when you see that someone relies on that, less. And obviously, if someone has, a lot of cough associated or other things that are sort of compounded by the asthma itself, which is just hypersensitivity of the airway, you get that better. People obviously feel better day to day, so that's great too, right?
Yeah, that's good.
Yeah.
Okay.